Hello everyone. A lot of guys were asking me about MRCP PACES guidance, how to prepare for that, because most of the candidates, when they start preparing, they don't know the resources, they don't know how and from where to start. So I wanted to come on live and guide you in an interactive session where you can ask questions, and maybe I might be able to share my experiences if that's going to help you. So first of all, you need to get an idea of what PACES is, PACES 23, because previously PACES had different format, and after 2023 they changed the format, and now there are 5 stations. The skills, previously there were 7 skills that were assessed, and even now the same skills, the same skills are assessed even now, but the format is different. So you need to first of all get the idea, grasp the idea what PACES 23 is, what the stations are, and what skills they are expecting. So I'm going to give you the details from A to Z. First of all, the stations. So 5 stations. Station one, there is communication skill station, where they will give you a short scenario outside, where you will have 5 minutes to read the scenario, get your notes, and you will be called in, and there will be a surrogate mostly. The examiners will be sitting around. Mostly there are 2 examiners who are going to assess you, and you will have 10 minutes, and in that 10 minute the examiners won't ask you anything. They will just assess you, how you are talking to the surrogate, how you are dealing his queries and concerns. And in communication stations, most of the scenarios are like breaking bad news, palliative care, dealing with a difficult patient, missed dose. Such are the scenarios that usually come in the PACES exam. And in the same station 1B, communication was 1A, and in station 1B, there is a short case type of station. In station 1B, there is a respiratory examination. You will do a real patient, and you will have 6 minutes to examine them, and then 4 minutes to answer the questions of the examiner. The examiners will be standing just beside you, and I reckon you have bowled a few Googles in your young. Well, I don't know. So coming back to station 1B, so that is a short case scenario. You will have 6 minutes to examine the patient, and 4 minutes to answer the questions of the examiner. The examiners will be standing just around you, and they will be assessing your each move, how you examine the patient, how you whether you maintain patient welfare or not, whether you cause any pain, and so on. Even when you percuss the patient, they're examining, they will be standing just like this and examine your percussion, whether you are doing the percussion right or not. And in that, after examination, there will be 4 minutes, and they will answer questions. You should be prepared, you should have prepared your findings and how to present the case, and uh, mm, applying the algorithm to connect the findings with the correct differential diagnosis, because in that 4 minutes you won't have any time to formulate the diagnosis. So you should have done that during your preparation. After station 1, again you will have 5 minutes to read the scenario of station 2, which is a long history station. Mostly there is only one main concern written in the outside station, and there will be tremors. Only like scenario will be a 22 years old patient presents with tremors. That's it. You can write your notes. You can uh, brainstorm your mind to like write down any questions, how you will take a history of tremors. And when you go in again, a surrogate mostly will be sitting in front of you. A patient, real patient, might or might not be uh, sitting behind you, but you will have to ask questions from the surrogate, not from the real patient. Maybe in the UK and such centers, international centers, don't have real patients to ask questions from, but maybe in the UK you might be asking questions from the real patient. But in international centers, you will have to ask questions from the surrogate, and then examine the real patient. Again, two examiners will be sitting around and assessing how you ask questions from the surrogate, and then how you examine the patient. In this station, you will have in the long history station, clinical consultation station, you will have total of 15 minutes to collect all the history and examine the patient and address their concerns. And then in the last 5 minutes, after 15 minutes, the examiner will ring the bell when 1 or 2 minutes are left. And when 15 minutes are done, you will have 5 minutes to present your case and answer the questions. That was station 2. And then station 3, again, you will have 5 minutes to, well, station 3, there is nothing to do actually. You don't have any scenario outside because there is again a short case station. There are two short cases in station 3, CVS and CNS. So after 5 minutes, you will be called in. First, you will examine the CVS, and again the same format: 6 minutes for examination and 4 minutes to answer the question. And in station 3B, neuro, again 6 minutes to examine the patient and 4 minutes to answer the question. Moving on to station 4, you will have 5 minutes to read the scenario. Again, there will be one communication station, and inside that 4B there will be abdomen station, short case. And moving on to station 5, that is again long clinical consultation. You will have main complaint written outside station 5. You can brainstorm your ideas, what questions you might be asking. Like for example, it might be written: the patient presents with weight gain. 35-year-old patient present, female patient presents with weight gain. So you need to apply the algorithm of what questions you might be asking to reach the diagnosis if a patient presents with weight gain. So you move in to station 5, ask questions, examine the patient. Let's say it is hypothyroidism. You suspect it to be hypothyroidism, but you should have other differential diagnosis to present the examiners to. Now coming to technicalities, this is a quick format. 7 skills are assessed. I will come to the technicalities later. 7 skills: physical examination, how you examine the patient, whether you examine the patient thoroughly or not, all steps are satisfied or not. Then identifying physical signs. Then other skill they are assessing you is differential diagnosis, whether you formulate a correct or appropriate differential diagnosis or not. Fourth one is clinical judgment, whether yeah, okay, you have diagnosed it, now whether you manage it appropriately or not. So this is clinical judgment. These are four skills. Three skills are addressing patient concerns. These skills are as important as the first four one. Mostly, yeah, candidates fail because they cannot identify physical signs properly, and they cannot formulate an appropriate differential diagnosis properly. Yeah, most of the candidates fail because of that. But uh, skills like addressing patient concern, maintaining patient welfare, and communication skills, taking an appropriate history, dealing with, like you can say, difficult patient, and all of those come in, things come in communication skills, and you should be above average in these three skills too, because they compile the result uh, in a fashion of the skills. Like for example, uh, first skill, physical examination, it is on most of the stations. If you are getting above average at all stations in physical examination skill, okay, you have passed that skill. Same for, let's say, identifying physical signs, differential diagnosis, communication skills, maintaining patient welfare, addressing patient concerns, all of that. Let's say while formulating differential diagnosis, at some stations you got above average, at some stations you were completely poor, and you have the margin, some margin of error. But if you have failed, let's suppose if you have failed the differential diagnosis skill but have passed all other skills, in fact your collective score is, let's say, 140 out of 168, unfortunately you have failed the exam because all the 7 skills are not passed, right? So like I said in the beginning, you need to be expert at all the 7 skills. Not maybe expert, not maybe perfect, but above average. You need to score uh, a good marks amount of marks in all the 7 skills to pass this exam. That is what makes this exam difficult. Otherwise, to be honest, this exam is possible. Yeah, the horror is rare, and uh, we have all been, even the candidates who have passed the exam are in the same boat in the beginning. But when you pass the exam, you come to realize that uh, it is an exam of technique. Yeah, the horror is real, but if you apply the correct technique, then you can easily pass the exam. Now, coming to technicalities, as I mentioned, like I said, most candidates fail in identifying physical signs and formulating a correct diagnosis. And why is that? When you cannot find the correct findings, or if your findings are incorrect for whatever reason, you cannot formulate a good differential diagnosis. And if your differential diagnosis is wrong, obviously you cannot apply the correct management. So these three skills are connected: uh, identifying physical signs, formulating differential diagnosis, and clinical judgment. For example, let me give you an example. Uh, while examining chest of the patient, if the patient originally has, let's say, V's, but you incorrectly diagnose it as crepitations, then obviously you won't label it as obstructive lung airway disease like COPD or asthma. You will label it like ILD or maybe pneumonia or something like that. So your differential diagnosis, because you couldn't identify the signs correctly, your differential diagnosis got wrong. And now you already know the management of asthma or COPD is different than management of ILD. So in clinical judgment, obviously you won't answer the questions appropriately, and your clinical judgment would fail too, right? uh, Also, like I said, practice, practice, practice. Okay, yes, but practice does not mean only examination, or uh, going to different kind of patients and examining them again and again. Yeah, that is important, but what is more important also is practicing with your partner, with your study partner, how to present the case. And if you are faced with this set of findings, your differential diagnosis should come abruptly. You don't have time to over there to think, well, yeah, if these findings are present, then that would be the diagnosis. No, you don't have time for that. You are examining the patient, you come across any finding, you should be thinking all the diagnosis in the back of your mind, what it could be. And when your time is up and you come for viva to present the case, you should start right away, right? You shouldn't wait to think. You should have practiced with your study partner so much that everything should come out fluently, and uh, like river flowing into the ocean, right? It doesn't think whether what is going to happen, whether you should uh, think it through to answer the question. No, you don't have time for that. Just practice, 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 and apply the practice in the real exam, and trust me, you will pass the exam. And coming to resources, you can practice communication skill and clinical history. Again, study partner is important to practice all the skills. You should have at least one, not more, just one study partner is enough, and practice with them daily, on daily basis, even a small amount, but practice with them daily. So communication skills and long clinical history, you can practice them with cases for PACES book, from PACES book from past test maybe. And there are other resources like Clinical Skills Pro. They have good communication skills videos, although I didn't like their clinical history station videos. Past test, all the past test has good clinical history station videos, short case videos, but I'm not, to be honest, not satisfied with their communication station videos. Also, for the other stations like short cases like CVS, CNS, and abdomen, chest, you can watch past test station videos, but these are for only for the beginners, right? Because first you need to get the idea of complete physical examination, and maybe practice on normal patient, but then go to real patients, examine real patients, and examine them again and again, uh, so much so that the examination and the physical findings are on your fingertips, right? uh, yeah, that was all about it. So if you have any question, you can ask. My cat completed my diagnosis. I don't know what that means. If anyone asks any question, I might be able to share. Otherwise, uh, about my experience, how was my exam, uh, what went wrong, and what was how I came through it. I will make another video, detailed video maybe. So I guess that's it. We can have maybe another session again. uh, Maybe that would be a great favor for all of us, for all the candidates. uh, because you see, I know, again, the horror of PACES exam is real, but if you practice it with your study partner and practice it again and again on the real patients, trust me, it is possible. Okay then, goodbye everyone, and good luck with your exams. If you have any question, you can comment it or maybe message me personally. Goodbye.